If it weren't for COVID, we would not be going on bypass at all, and we would have more than enough capacity.
It was last night when all area hospitals reached a tipping point, forcing them all to go on EMS bypass, which means they were not accepting ambulances. Kaylee Kirby joining us live tonight after talking to hospital leaders about why this happened. And Kaylee, there is still one hospital on bypass right now tonight, correct?
Yeah, that's right, Jeff, and it's UTMC. Hospital leaders tell me what happened last night really was a domino effect. One hospital went on EMS bypass and it put a strain on all the other hospitals, ultimately leading up to all 8 getting at a breaking point.
It's something that we've talked about. We've known that it could happen. We've come close in the past, but in my experience, this is the first time that we've had all 8 emergency departments in the city close down or go on EMS diversion.
For the first time in more than 2 decades, all Lucas County hospitals went on EMS bypass. Leaders say every hospital has its own tipping points. There's no strict criteria for making the call, rather a combination of circumstances. Those include emergency room wait times, the number of patients inside a hospital, staffing, and a number of other reasons.
When that happens, each hospital has to balance the tension of being able to provide safe and high quality care for the next people that come in through the door, and still provide that safe and high quality care for people who are already in the hospital.
Health leaders say it's unfortunate it happened, but it's a process to help make sure the best care is given to the people who are already in the hospital. And yes, COVID-19 is part of the strain.
The Delta variant came along, and now we have an increase in COVID cases, but we have still that pent-up demand for care. We have a lessened fear of COVID.
When we are stretched to the point of where we don't feel it's safe to take care of that next patient for the next few minutes or an hour or so, it's hard for us.
Now, I also reached out to local nurses unions to see what they're experiencing right now, and I have not heard back. Meanwhile, hospital leaders say if what you are experiencing right now needs immediate need and a hospital is on EMS bypass, you can expect longer wait times. Reporting live in Central Toledo, Kaylee Kirby, WTOL 11.